Ladies and gentlemen, with profound pride, I humbly stand before you to pay my gratitude to sage Sushruta. This deliberation is mainly addressed to young faculties and future generation to know in detail about Maharshi Sushruta and his contribution to maintain his legacy with pride. Since I have tried to reach the copies of original manuscript, some of the slides will be black and white and old. I shall mention the English translation of slokas written above in some of the slides. Several paintings have been drawn by a devoted artist attached to the Department of Archaeology. He analyzed the description of written in Sanskrit with scholars and drew accordingly. There are few controversies which I shall ignore to convey a clear concept. Friends, appreciate that you are also breathing the same air of Kashi, having the fragrance of sage Sushruta. Today I shall discuss about the ancient innovations, modern relevance, celebrating the genius Sushruta. As I stood beside the bust of sage Sushruta, a spark traveled from head to toe, which is very difficult to explain in words. I shall commence my presentation with floral tribute to Maharshi. I have the privilege of spending my whole professional life in the same city, Kashi, where Sage Sushruta lived, practiced, innovated, taught, wrote, and propagated. My deliberation is based on authentic literature and discussion with archaeologists, ancient historians, and Ayurvedacharyas. This presentation will encompass ancient history, details of Maharshi Sushruta's contribution, and modern medicine. The segments are relevant references, archaeological aspect, Vedas of human mythology, history of Ayurveda, evolution of instruments by Sushruta, anatomical aspects described by him, contribution to plastic surgery, basic principles of surgery, his description about procedures, and how Sushruta influenced us. Maharshi Sushruta was the son of Maharshi Vishwamitra and disciple of Kashiraj Devadas Dhanvantari. Archaeologically, the history of Varanasi goes back to 1200 BC of continuous habitation, as per the information of excavation of Adi Keshav Ghat, which reads, Rajghat bears traces of ancient as well as modern habitation of man in an unbroken continuity. This site, about 0.33 kilometer from the Lal Khan's tomb, covers an area of about 1 square kilometer. The antiquity of the city and its continuous history was not confirmed by any archaeological evidence as late as 1940 AD, when the mound of Rajghat was accidentally discovered by a railway contractor in course of remodeling of the Kashi. This is the Adi Keshav Ghat, which in 2002 I visited along with the Central Excavation Team and the Archaeology Department. Kashi is the earliest living city on earth. These are the maps of old Kashi. James Prinsep in 1822 AD did a lot of research on Kashi and Sage Sushruta. So these are the maps drawn by him. Sage Sushruta practiced Ayurvedic surgery. Four main Vedas of human mythology are Rig Veda, Yajur Veda, Sham Veda, and Atharva Veda. Ayurveda knowledge of life, is an evolution of Atharva Veda. This is a systematic traditional medicine originating in the Indian subcontinent. Principles of universe are fire, earth, and water. These are the paintings of the same artist. In Ayurveda, space and air come together to create three different types of bioenergies which constitute the human body. There are eight branches of Ayurveda: internal medicine, pediatrics, psychiatry, ENT and cephalic diseases, surgery, toxicology, rejuvenation therapy, and aphrodisiac treatment. Shalya Chikitsa deals with science of surgery and removal of foreign objects from the body. Sushruta was not only a practitioner but a teacher as well. The credit of using Ayurveda to combat suffering goes to Lord Dhanvantari, who was incarnated as King Devadas of Varanasi. Few influential works of that time are Charaka Samhita from the school of general medicine and Sushruta Samhita from the school of surgery, a compilation of the work of sage Sushruta. He learned the basics of Ayurveda from King Devadas and laid the foundation for surgery written in the form of Sanskrit manuscript of Ayurvedic medicine. I could access large number of old manuscripts. Most of them were English translation, as well as the modern publications of Sushruta Samhita. I also consulted large number of references, out of which these 10 were most important, and all this forms the foundation of this presentation. He described 8 types of surgical interventions: incision, excision, puncturing, scraping, probing, extraction, draining, and stitching. Instruments used were inspired by nature. They were made up of metals, horns, and wood. Again, these are the creation of the same artist. Objects recovered from the excavation sites at Rajghat on the southern outskirts of Varanasi proved that iron was widely used in Vedic era, which Sushruta would have used for surgical purposes. Again, the paintings of the artist. It is an accepted fact that ancient Indian metallurgy was extremely advanced. These are some of the artifacts recovered from the excavated sites. Instruments were either blunt or sharp. They are used even today in different specialities. Mouths of instruments resembled different birds and animals that he observed. He described 20 different types of sharp instruments and 101 types of blunt instruments. He believed that to understand Ayurveda, it is important to understand human anatomy. He would wait at the confluence of Varuna and Ganga rivers and capture to dissect human dead bodies to teach anatomy to his disciples. This was considered desecration by most Hindus. He insisted learning embryology and then anatomy. He divided the human body into 3 categories: superficial structures, internal structures, and deeper structures. He wrote details of the various organs of the body. He also enumerated 700 veins and 24 main arteries. During surgery, he alleviated pain by using medicated wine to intoxicate and desensitize the patient. He recognized the use of drugs and described 650 different drugs, including 395 of plant origin, 57 of animal origin, and 60 from mineral substances and metals. Contributions to plastic surgery were twofold: principles of plastic surgery and practices of plastic surgery. He did 15 different types of ear plastic, described pedicle flap for repair of damaged ear, damaged nose, and lip plastic. He said plastic surgery is a relationship between flesh and blood, where if there is an excess or lack of blood, the graft will not survive. The same was said in 20th century by Sir Harold Gillis. Plastic surgery is a race between beauty and blood supply. This is the needle holder which was used by Sir Harold Gillis. He developed rhinoplasty to reconstruct noses of people who had been deformed or amputated as a form of criminal punishment. He dissected skin from the cheek and grafted onto the nose, which is a precursor of Indian forehead rhinoplasty. He said, through continuity survives the need of a viable pedicle in continuity for the survival of the flap, which is the essence of modern technique. For the importance of hemostasis, he said, blood is the origin of the body. The body totally depends upon it. Hence, every attempt must be made to preserve it. About qualities of incision, he writes, it should be of adequate length, extensible, having regular and uniformly cut edges, having all the layers cleanly incised, and should be independent. The Sushruta Samhita is in two parts, Purva Tantra and Uttara Tantra. They contain 184 chapters, description of 1,102 illnesses, a detailed study of anatomy and surgery, adapted by most modern medical practices. Purva Tantra deals with medicine, pathology, anatomy and embryology, different therapies, and toxicology. And Uttara Tantra deals with ophthalmology and hygiene. His legacy in the field of surgery varied from orthopedics, principles of various surgical procedures, management of fracture remains unchanged. His clinical description is similar as in modern medical texts. He describes 60 different steps of managing trauma. He was aware of the need of wound management. He said after incision and removal of the cause of trouble and having made the wound bloodless, instruction should be given regarding its further management. Samhita also describes suturing techniques in great detail, types of needles, different suture materials for management of different types of wounds. The suturing techniques he used were blanket sutures, continuous suture, interrupted suture, and subcuticular suture. He used different types of needles, round body, triangular cutting, curved round body, atraumatic needle. The sutures were of plant fibers, silk, horsetail hair, and head as clips and tendon fibers. He also wrote extensively on how to manage traumatic scars with variety of pastes and oils. For pigmenting procedure, depigmenting procedure, restoration of normal skin color, regrowth of hair, and depilation. He was considerably ahead of his time. The knowledge traveled to Greece, Persia, and Arabia across the ocean after his death. His rhinoplasty by Indian forehead flap is known worldwide, though initially it was a cheek flap. How Sushruta influenced us? He highlighted the importance of anatomy and physiology. We do emphasize the same, stating that our aim is structural and functional recovery. He stated the importance of reconstruction by like tissue. So do we. Prior to surgery, he used to plan and draw based on rationality. We follow him. He planned the dimension of the flap using leaf. We also do planning in reverse with lint piece. It is also the fundamental principle today and will remain forever. He performed extensive cadaveric dissection and taught his disciples and necessity of anatomical knowledge. We do the same. We also organize cadaveric dissection workshops. He performed a variety of operations all over the body without any specific specialty, as that was the need of society in his time. We also perform different types of procedures to impart skill and knowledge to trainees from head to toe, especially in teaching institutions. On further exploration of literature, a diagram of partial ear reconstruction emerges. It has a close bearing with the technique we use. He classified burn into 4 categories and accordingly suggested treatment relevant to the present understanding. For extensive burn wounds, he preferred close dressing, which is also practiced by the present Ayurvedacharyas. They apply the Ayurvedic cream and cover it with large leaves. We also prefer close dressing. He emphasized the importance of blood supply for the success of surgery and discovery of newer methods. We are also involved in the study of vasculature, network, and circulation in tissue. In 1974, we used to do such extensive study on animal models. This is the vasculature of the rabbit which we studied at that time with very relevant information. Later, we did cadaveric dissection. We all do it in fresh cadavers. And as the technology advances, these are the CT angiography and so on. So we are also interested to understand the vascular network as he used to. He must have faced competition with his contemporaries who were equally competent. However, the world acknowledges him because of his contribution, because he wrote extensively about surgical methods and different medicines. We also know the importance of publication to establish our identity in the scientific world. These are the dissertations under me by different postgraduate students, all were concerning about the vasculature and the clinical application. He knew the importance of dispersing knowledge to his disciples through practical demonstration, involving them as assistants with theoretical background, we try to follow similar methods. He wrote about the lacunae and how he modified to get better outcome. We also constantly analyze failures and deficiencies to improve our results. Sushruta had remarkable observation and analytical power to visualize beauty in the beast, which we should inherit. For example, this is a myosseous flap, including the trapezius muscle and the spine of scapula, and the artist finds king, imperialism, master of all eye survey. Now, once you see this uh, painting, then you can also visualize the beauty in the beast. Similarly, this is a specimen of carcinoma cheek along with the lymph nodes. And here the artist finds a shell, a crocodile, a watchtower on the rock. Oceanic panorama. A complete mandibulectomy for extensive adamantinoma. The inquisitive eye finds a cat-like. The caption is feline attributes. Similarly, Ectopia vesicae, the artist finds chimpanzee in this specimen and imagines it, our ancestor. So with this quality, he designed a large number of surgical instruments simulating natural animals and birds, which we use even today. He used several indigenous methods as per the necessity. We also keep on improvising instruments according to our need. We also devise many procedures or make use of articles apart from its recommended use. For example, use of disproven needle in rhinoplasty or in tendon surgery, or long Venflon needle to inject local anesthesia for a large area through a single prick causing minimal pain, such as for excision of large benign lesions, tumescent injection prior to liposuction, etc. He used different types of anesthetic agents to deal with a variety of surgical and medical ailments. We also apply various methods of anesthesia according to the surgical procedure. He insisted for maintenance of instruments. We also take care of our key instruments personally, such as fine scissors and forceps, skin grafting knife, etc. He insisted to analyze results and failures. In order to improve, we exactly follow it. Sushruta believed in teamwork and was surrounded by his associates and disciples in life. Guru Shishya Parampara remains the same. That is why he influences every generation to walk in the path shown by him. Sushruta is the father of plastic surgery, and the Association of Plastic Surgeons of India celebrates his life and time by giving him a pride position in the association's emblem. Ladies and gentlemen, in the annals of medical history, Sushruta stands as a beacon of innovation and dedication. From pioneering techniques in diverse surgery to his holistic approach to patient care, Sushruta's contribution is a fusion of skill and compassion. Friends, as a medical professional, his legacy should always serve as a definitive resource for advancements, bearing in mind that every patient is a reflection of the humanity we are privileged to serve. Thus, we walk on the path shown by Sage Sushruta with pride, acquiring the advancement in knowledge and technology. Thank you very much for your patient hearing.